Hi, Dr. Ford. How are you doing?
Good, I'm doing fine. Thank you. How are you doing?
Doing well, doing well. I know it's a time of change for all of us. What have you been seeing in Oklahoma?
Well, we've been seeing a lot in Oklahoma, obviously with the pandemic and things going around. Just a trying time for all healthcare providers and our state as a whole with what's going on. And, change is essentially happening every day right now for us out here. But the good thing about change is it has to happen, and this is an opportunity for us to change and create the change that is going to. Yeah.
I agree. I agree. I think this is a wonderful opportunity that's highlighting many things in healthcare that we may not have seen before, or we've overlooked, or we've just gotten so used to that we just maybe turn a blind eye. What are some of the things that you're seeing that have come up in your clinic as far as change, where it's going, where it was, what you're looking forward to in the future? What's been your big changes?
Face-to-face services. So currently in our clinic, we do provide telehealth, and we were providing telehealth previously before this pandemic. However, since this has happened, we are providing telehealth at a much larger scale. And I've received a lot of calls from other providers also with concerns and questions about telehealth. This is something, like I said, we were doing in the past, but now due to the pandemic, we're doing telehealth at a much larger scale than we were doing before. So for us, it's been very good and very positive. And, I was actually telling my staff this morning that, this is change is here and change is coming. And it's important for us to stay on top of the change and create the change. Because I believe if you can create the change or help assist with creating the change, things go a lot better.
Mhm. I definitely agree. And I think that we are seeing change as far as telehealth goes. I know that you and I have spoken about this before, and that we have
Yes,
seen some resistance
yes,
in some providers as far
yes,
as telehealth goes. And now they're put into a situation where they have to step up to the demands of telehealth.
yes.
So have you seen any of that with providers that you've worked with? And if you have you given them any words of wisdom, or what have you said to help encourage them along during this time?
So in our current clinic, it hasn't been a resistance just because most of our providers were already using telehealth. Maybe not as much as they are now, but they were currently using telehealth, or at least had access to use telehealth as one of their tools. But um, I have spoken to many providers that are still resistant with telehealth and not very comfortable with it. For us, it's just been different because we had a long history with telehealth and using it. It's already, even before the pandemic, it was already on our website to where our patients had access to use it and utilize it. And most of our patients were using it. So it's just been different. The providers that are resistant to it, and not wanting to do it, and I've just told them, change is something that we don't have control of all the time. And it goes back to what Dr. Cummings told us many years ago. It's a couple things that happen with change. You can resist change, you can roll with change, you can be a part of the change, or you can deny the change. And depending on which one of those you pick depends on where your future lies. Case in point, Southwestern Bell, they didn't stay up with the change. And now if you're under 40 or 30, you really don't understand or know the role that Southwestern Bell played in today's world with the telephone. And that's strictly due to cell phones. And if you look at patient care and where we are with patient care, this definitely puts in perspective ways to improve patient care as it relates to face-to-face, because the terms face-to-face is this is a perfect opportunity, but now it appears that face-to-face is outdated, and there's a more robust, easier way to get contact with our patients while still improving care and improving patient satisfaction and improving outcomes.
Absolutely. Absolutely. Of course, I'm a huge fan of telehealth. I've been doing telehealth for a few years now, and strong believer here.
Mm-hmm.
So I have, just like you, have been speaking with other providers that have been a little bit more resistant to telehealth and have believed in the face-to-face model as being the pristine way to work with a patient. But there's also several research studies that show that telehealth can be as effective, if not more effective, when treating patients.
Yes.
So that's usually when I speak with a resistant provider, that's what I tell them. And I can give them the literature to back this up because I'm very passionate about it. And like you, I believe that that is part of the future. And that's something that we need to roll with. But again, like Dr. Cummings and like you also brought up, I mean, we can be resistant. We can deny. We can turn the other cheek and say it doesn't exist. But right now, it does exist. It is very real. And when we look at what's happening, will telehealth, in your opinion now, become more of a norm than just an exception?
I believe it's going to become more of the norm going forward. However, it really boils down to, I strongly believe it really boils down to the data that the insurance companies get when all of this is open, with the percentage of providers that were using telehealth and what were the outcomes. What was the outcomes that they received while utilizing telehealth? What was the overall patient satisfaction of using telehealth? And then the cost of care. What has it done to the cost of care? And I think the overall answer with telehealth will be contingent on those three things right there: patient care,
Absolutely.
outcomes, and patient satisfaction.
So what would you recommend then for providers to do now while they do have, I guess, an attentive audience of patients who are, seeing them via telehealth? What would you recommend as far as data collection? Is there any method that you would suggest? Is it just jot down in a notebook? What are you thinking? How have you guys been collecting this data?
Well, so for what we've been doing, we're still going to collect the same data that we've previously been doing. It's just not going to be in person as it was in the past. Now it's going to be via telehealth. The data collections that we do through the traditional face-to-face, we'll still obtain all that information. But now with telehealth, we'll begin collecting that information via telehealth and just compare the two. This was done via telehealth, this was done traditional face-to-face, and collecting all the data, and then, making sure we get the patient satisfaction data along with that too, because I think that's very, very important.
Okay, so something that I guess I would add to that as well is attitude of provider.
Yes.
Because I believe attitude of provider could transfer to the client or the patient, depending on what you're working in. I think that is going to be important, because if your provider has a negative attitude towards telehealth and this is an inconvenience for them and they prefer to see patients face to face, I think that will transfer to the patient. So also having a positive attitude when they're working with the patient, so that way our data collection isn't skewed.
Yeah, very good point. That definitely does make a difference, because, that's definitely, that energy or lack of energy is definitely going to transfer along over to the patient. So I agree.
Anything that, because I know we're going to try to keep this short snippet, but anything that you would recommend for a provider, whether it be, to have that positive energy and that positive attitude, or collecting data, anything that you could recommend to help them get through this time and maybe have a different attitude towards it?
A positive mindset, and the ability to be innovative and innovate. Even if it doesn't exist, create it, flat out. And I told my staff that this morning: if it doesn't exist, let's create it. Let's be the new wave of change. That's the mindset we're going at it in, because the good thing is we still have access. We're still working, and we still have access to serve the community and treat our patients as we did in the past. Is it different? Absolutely. Can we do it? Absolutely. You know, so just be very innovative and let's create the change that's going to happen.
So it's having that positive attitude, an
Yes.
open mind, being innovative and pushing forward. So a lot of acceptance, accepting where we're at right now and using it as opportunity rather than a lack of opportunity, rather than falling into a mindset of despair and this is what we have to do, but looking at it as, you know, I am part of a wave of the future in healthcare.
Yeah, and continuing to improve access to care. This is another tool that the insurances have allowed us to improve access to care. You know, there are many reports out about the communities that are suffering the most through this pandemic and the communities that are doing the best in this pandemic. And that has a lot to do with access to care, access to insurance and access to care. And this is a definite way to improve care and improve access to care. Definitely an opportunity we all as providers have to take advantage of.
So it's time for providers to step up and realize we are the change.
Yes, without a
Okay.
doubt.
All right. So on that note, we're going to end our little, I don't know, what should we call this? I don't know, our pandemic
Yeah,
interference. Because
perfect.
we're trying to interfere right now and create and move forward. And that's what we do.
Creating the change.
That's us.
Yeah, creating the change.
Absolutely. So, okay, until next time, we'll sign off here and then we will get together again and have another discussion.
All right, see you later. Thanks.